Welcome to Addiction Group's podcast, where we address pressing questions about addiction. Our goal is to provide insight and guidance for those seeking answers. I'm your host, Anna. Welcome back to Addiction Group's podcast, where we delve into the challenges and victories surrounding addiction and recovery. Today we have Ben, a specialist in addiction treatment, joining us to talk about a substance that's been wreaking havoc across the nation, methamphetamine, or simply meth. Hi, Ben. Can you give us a little background on how meth affects those who use it?
Absolutely, Anna. Meth is an extremely addictive substance that significantly alters brain chemistry by increasing levels of dopamine and serotonin. Initially, users might feel a rush of energy, sharpened focus, intense pleasure, and even an increased libido. These powerful effects are what usually draw people towards the drug, but they often lead to a dependence that can be hard to shake off.
It sounds pretty intense right from the start. So what are some of the side effects that come with meth use?
The side effects are pretty severe, Anna. Users often experience a rapid heart rate, elevated blood pressure and body temperature, as well as insomnia and anxiety. More seriously, it can lead to paranoia, aggression, stroke, heart attack, tremors, convulsions, and even death. Meth really takes a toll on the body and mind.
That's quite a list. Now, I've heard the term tweaking related to meth use. Could you explain what that is?
Certainly. Tweaking is essentially another word for meth withdrawal, which can last anywhere from a few days to about 2 weeks. During this time, a person can experience extreme paranoia, irritability, and confusion. It can be so uncomfortable that it often drives individuals to use the drug again to alleviate those feelings.
Let's talk about how someone might recognize meth addiction. What signs and symptoms should people look for?
Recognizing meth addiction is key. Look out for hyperactivity, dilated pupils, twitching, facial tics, and significant weight loss. You may also notice mood swings, poor hygiene habits, dental damage, and disrupted sleeping patterns. Meth addiction can take over someone's life pretty quickly, so it's important to be aware of these signs.
If someone recognizes these symptoms in themselves or a loved one, what does the treatment timeline look like?
Meth addiction treatment is very effective if the person is willing to go through the stages. First, there's an intervention where loved ones confront the person about their addiction. It's a caring way to make them aware of the problem. After recognizing the need for help, they'll choose between inpatient or outpatient treatment, depending on their specific situation.
And after choosing a treatment plan?
The next step is detoxification. This should be medically supervised to manage withdrawal symptoms safely. Without FDA-approved medication for meth addiction specifically, it's about managing the process carefully. After detox, behavioral therapies like cognitive behavioral therapy and narrative therapy are quite effective.
How about counseling and aftercare?
Counseling is all about getting to the root of the addiction, providing emotional support, and learning new ways to cope. Aftercare programs then provide ongoing support. Groups like Narcotics Anonymous and Crystal Meth Anonymous and SMART, self-management and recovery training, are popular options that offer continuing help.
Before we conclude, can you touch on how challenging meth withdrawal can be?
Meth withdrawal is incredibly difficult. It includes symptoms like depression, appetite changes, fatigue, muscle pain, mood swings, and intense cravings for meth. The level of discomfort is so high that many people relapse just to get relief.
It certainly sounds like a tough journey, but with the right support, it's one that can lead to recovery. Ben, thanks for sharing this invaluable information with us today.
Anytime, Anna. It's vital to spread knowledge about meth addiction and recovery so that those affected can find the help they need.
To our listeners, thanks for tuning in. Remember, if you or someone you know is struggling with addiction, there's hope and there is help. We'll be back with more insights on Addiction Group's podcast. Stay informed and take care. Thank you for tuning into Addiction Group's podcast. We hope our discussions bring clarity to your queries about addiction. Remember, we're here to support and guide you. Until next time, stay informed and stay strong.